So this video is based on merit goods. There's already been a video created on public goods, but what we're going to look at within this particular video is we're going to look first of all, what is a merit good? We're going to look at examples of merit goods, we're going to consider characteristics of merit goods, and we're going to look at the reason why merit goods are provided and why the government intervene in order to offer these types of goods. So to begin with, let's have a look at the characteristics. So when we're looking at the characteristics, the first characteristic is often that people do not realise the true personal benefits, and they often underestimate the benefits of these types of goods. So that might be in terms of underestimating the benefit of education, it might be underestimating the benefit of vaccinations or healthcare, and when we say they underestimate or do not realise the true personal benefits, what we mean by that is if it was left to a free market, it might be underconsumed. And that could be because obviously they might not be able to afford it, but it might also be because they're not willing to pay a substantial amount for these types of goods because again they underestimate the true benefits of them. The second factor and the second characteristic is they have positive externalities. So just like in terms of public goods do, merit goods as well have those positive externalities. And all I mean by that is in terms of, if we look at the diagram again and what we've got, and we're looking at it from a consumption point of view because we're consuming these merit goods. But if we have the marginal private benefits of these goods, so that in terms of the transaction of that good. So for example, if somebody was buying healthcare and the transaction within that healthcare, maybe they were purchasing a vaccination. So they're buying a vaccination, and obviously the amount involved in buying that vaccination, let's say it's a private hospital, then obviously there'll be a benefit of the revenue that they receive from selling that vaccination to the patient. But actually that vaccination does so much more for the third party, for society, because if we, and we are going to delve into COVID within this video, but if we think about these new COVID vaccinations that are coming in, clearly if because of the R rate and because of how contagious it is, if you get that vaccination, then you're obviously going to help to bring that R rate down and you're going to help to stop the spread. And therefore, just by you buying that vaccination at a private healthcare hospital, for example, it will obviously benefit everybody who you come in contact with because you're no longer a risk. So then what we look at is in terms of the marginal social benefit. Now, the reason why I've drawn it like this, and it's slightly different to the diagram that I drew in the public good, is because the more of this which is consumed, the greater the benefit will be on society. So for example, yeah, you might buy one vaccination for one patient, and it will have benefits, but obviously the more vaccinations that you buy to vaccinate patients, then obviously the greater the benefit will be for society. Now, if we look at some other examples, and again, if you think about education, you can buy, again, we'll look at in terms of private schools, and at the moment I'm going to begin looking at private hospitals, private schools, and then I'm going to roll it out to why the government intervene. But if you think about private education, obviously buying a placement at a private school, that's going to have benefits, and you're going to have that private transaction, the school receiving the revenue for that patient. For that student. Now, they'll be educated, and what they do with that education in terms of the skill level will go on to boost maybe the productivity of the economy and help towards national output, and that will obviously then help living standards possibly within the economy. But obviously the more people that get educated, the more people who have access to education, then we can start to see an improvement in living standards for everybody, because it'll trickle down and it'll help others. Now, I mentioned the private sector to begin with. And the reason why I'm just talking about the private sector is because we have to think about it. If it was a free market, then that's all that would be available, the private sector. We'd have private education, we'd have private healthcare. But the issue with that is, again, going back to the previous characteristics, they might be underconsumed. And they might be underconsumed mostly because of probably the price. Some people just simply won't be able to afford it, and they won't be able to afford the best type of education. And they might have to, if they're going to afford any type of education, it might be to a really low standard. Maybe in terms of healthcare, they just simply cannot afford the medical insurance, because often with a private healthcare, you'd have to buy into medical insurance to be able to access it, but you might not be able to, so therefore you just go without. And the government feels that these type of goods, because they might be underconsumed, for those reasons, they have to intervene and they have to offer them to society. And that's where we get obviously state schools and where we get the NHS. And the reason for that obviously is because they feel that these goods are so essential for society, they have to be consumed. And if that means they have to provide them for free, that's what they'll do. Now again, we can argue, is it for free? Clearly tax revenue goes towards that contribution to be paying for these types of merit goods to be offered. So again, when we look at positive externalities, it exists if the production and consumption of a good or service benefits a third party not directly involved in the market transaction. Now this diagram is just a consumption diagram. There is another positive externality which is based on production, but I'm not going to go into that within this video. Right, so to begin with, why does it relate to market failure? Well, it's to do again with this issue of it being underconsumed. So this occurs when there's inefficient allocation of resources in a free market. So if they're underconsumed, then obviously people's healthcare is going to be at risk. People's skill level and education is going to be at risk. And if that's the case, then we're going to experience market failure because there is that inefficient allocation, and therefore the government needs to intervene to try to solve this market failure or just stop any chance of that market failure from taking place. So therefore there is a belief that merit goods would be underconsumed, so the government therefore offers them. Now, what I'm going to do is I'm just going to show you a short video on the NHS because that's one of the biggest examples that we're going to look at in terms of merit goods within this video.
The National Health Service has been called the closest thing the British have to a religion. Ever since its creation in 1948, it's held a special place in the national psyche, and right from the beginning its workforce has been drawn from all over the world. The one thing most non-Brits know about the NHS is that it's free. So if you visit the doctor, it's free. If you need an operation, it's free. Having a baby is free. Parking at the hospital is... Actually, they charge you for parking at the hospital. But if you get hit by a car and need to go to hospital by ambulance, it's free. While the NHS may be free to use, it's not actually free. Next year's health budget will be something like £140 billion. The total cost works out to about £2,000 per year per person, which sounds a lot, but it's actually quite low by international standards. In the US, for example, per capita healthcare spending is more than double that. The NHS may be one of the most efficient health services in the world, but it's also a sprawling entity. UK-wide, there is a baffling array of NHS bodies. Over 500 clinical commissioning groups, health boards and hospital trusts, about 8,000 GP surgeries, plus the voluntary sector, private providers, and others. It also has numerous separate bodies for regulation, training, and strategy. Ooh, where was I? If that sounds like a system sorely in need of reform, that is the reformed version. The product of a 2012 Act of Parliament designed to give much more power to doctors in deciding how the money gets spent. In fact, the whole history of the NHS is a series of compromises between politicians and doctors. When the Labour government first created the NHS in 1948, it was in the face of bitter opposition from the Doctors' Trade Union, the British Medical Association. One leading member of the BMA at the time said the NHS was the first step, and a big one, towards national socialism, and called the health minister, Aneurin Bevan, a medical furor. Move forward to the present day, doctors are barely more polite about their political paymasters. The current Health Secretary, Jeremy Hunt, has found that his name's become, unfortunately for him, rhyming slang for
to give them a 1% rise.
But if NHS history has been politically turbulent, it has also been packed with clinical advances. In 1958, polio and diphtheria vaccinations were rolled out nationally, drastically reducing deaths from these illnesses. In the 1960s, the contraceptive pill was given first to married women, then all women who wanted it. 1978 saw the world's first test tube baby being born. 1979, the first UK heart transplant. The 1980s saw pioneering use of keyhole surgery, and in 2002, the first gene therapy. But with glorious successes, there have also been terrible failures. In 2013, a report into appalling patient neglect at Stafford Hospital identified hundreds of vulnerable people who suffered at the hands of staff and called for a culture change in the NHS. Patients, the report said, were let down by a system that put cost-cutting and target chasing ahead of the quality of care. Winter brings the service's biggest challenges. Seasonal colds and flus can endanger the already sick. Staffing is stretched, and most non-hospital services close for the holidays. Hospital bed shortages are commonplace in winter. Despite these challenges, the NHS mostly works, and its founding principle remains a point of pride. Universal healthcare, free at the point of use.
As you can see from the video, there's a lot of benefits attached to the NHS. They have had criticism, and a lot of that is because actually there's arguments that it might be underfunded. Obviously, year in, year out, the funding for the NHS does tend to go up. But when you look at it in terms of, in real terms and per capita, especially per capita, you might actually find that the NHS funding is going down and it's becoming underfunded, especially during the austerity years under the Conservative government. Now, when we're looking at the NHS, we are not completely dismissing or criticising private healthcare, because actually private healthcare does play a part with the NHS as well. And what I've put here is the government sees a role for private hospitals in easing the traditional NHS problems with capacity, especially during the winter, which was mentioned in the video. And it helps to reduce waiting times and lists, which does actually relieve some of the pressure on the funding that goes towards the NHS. Now, private hospitals are often able to help, especially at short notice, because they typically run at occupancy levels of between 50 and 60%. Whilst the NHS, especially in winter, is beyond 100%. They've got people waiting in corridors and all the beds are taken up, and it's a real worry. And you can imagine, especially at this moment in time with COVID and everything that's taking place, even more pressure. So there is definitely a role for private healthcare, and merit goods and providing merit goods isn't a criticism of the private sector. It is simply saying that if you just left it to the private sector, then it would be underconsumed. Now, with more than 1 million patients seen every day, that is how important the NHS is. And like the video said, it's almost like a religion of Britain. It's the part of the fabric of British life, and it's something that we really celebrate. And in fact, it played a massive part in the London Olympics in the opening ceremony. We celebrated the fact that we have the NHS because it is world renowned. So it regularly features among the top reasons people feel proud to be Britain, leading to a broad consensus among political parties to protect it. However, it has been at risk, and there has been arguments that it started to be privatised, with certain parts of the NHS being sold off, especially actually without public knowledge, and that could be a real danger of this type of merit good, because obviously if it's privatised, will we have the same merit good in terms of being provided for us, and the characteristics of it not being underconsumed and having access to everybody within the economy. Now, again, when we're looking at healthcare, especially with regards to COVID, we can see how important the benefits are of healthcare. And it's not just COVID, it's lots of different factors. If we think about, for example, absenteeism in the workplace, the NHS helps support that, because it stops that absenteeism, which helps the companies and helps national output as well. So when we're thinking about the benefits, don't just think about patient and doctor, think about in terms of how it helps the wider economy as well. And again, when we're thinking about education, don't just think about student in the school, think about how it benefits everybody in the spillover effect on the third party, because that's what positive externalities relate to. Now, when we're looking at COVID, and I'm going to show you a couple of short videos based on the current situation of COVID-19. This was on the 18th of January, and the most recent statistics that I could get, but we can see here in terms of 89,243 deaths, and in fact, I did just get a notification saying that the UK, and it can be debated, it could be argued in terms of our data collection compared to other countries, but we've actually got the highest deaths now in the world. And there's over 3 million people that have now been tested positive for COVID. The estimated R rate is between 1.2 and 1.3. We are currently in a lockdown, and the daily infection growth rate is obviously positive 2% to 5%, which means obviously it's growing. However, the good news is that, again, even though there's over 3 million people that have been tested positive, there's also now over 3 million people who have been vaccinated, and that will continue to rise. And as soon as, obviously, we see these numbers and we see the effects of this vaccination, then that R rate will fall, and hopefully it'll stagnate and it'll stall the deaths and obviously the people who are tested positive. And that's how important these vaccinations are, and these vaccinations are another example of a merit good. Now, the reason why they're a merit good and, for example, not a public good, then we can look at it from the point of view there is rivalry. There's only so many vaccinations that go around. Now, I used to live in Dubai, and I was part of a healthcare system where I got health insurance through my employment. And I already see friends of mine online, especially on Instagram, going to get their vaccination, and they can get it through their healthcare, which is great, especially if you're, for example, a person who's quite wealthy, an individual who's able to afford it, and don't even have to consider any cost or anything like that. That's brilliant for them. But when you've got a situation where actually in some of these countries you've got high levels of inequality, then you've got people who can't afford it. And because of the private healthcare, there's some people who might not have private health insurance. And they might think to themselves, well, I don't want to buy it. I can't afford to buy it. So actually what I'm going to do is just I'm just going to leave it and hope that I don't get it, or hope if I do get it, I'll be absolutely fine. And that causes problems because obviously then they can spread it, and there's that risk involved. So when we're looking at the NHS and their ability to obviously give these vaccinations for free to pretty much the population, and they're hoping by this September of 2021 that everybody will be vaccinated. That's going to be obviously a very, very important I suppose, to see how that impacts the future in terms of returning back to normality. The other worry is obviously those people who do not want the vaccination, and it might not be because they don't value it in terms of what it can do, but it might be because they're worried about how it's being rushed, perhaps, and they don't believe it's there yet, or actually they just don't really believe that the COVID-19 is that much of an impact, or has that much of an impact, and that's a worry as well, and that's a concern, and that's why actually if the government offers it for free, it might just relieve some of those concerns, and it might actually get them to think, okay, well, it's free anyway, I might not really think COVID's a big deal, but I'm going to go get a vaccination anyway. And that can help. But if it was obviously under private healthcare, then they definitely will be thinking, well, I'm not paying for it. There's no chance. And that obviously has a risk.
Not even the most optimistic scientists dared to hope the first COVID vaccine could be this effective. Clinical trials have shown the prototype made by Pfizer and BioNTech is 90% effective. The companies are planning to apply for emergency approval to start rolling out the vaccine from the end of the month. 10 million doses should be in the UK stockpile by the end of the year, with another 30 million to follow.
We're very much hoping that two things will start to come to our aid. Number one, the mass testing, the kind I just described, the rapid turnaround testing, and then the other thing is now the realistic prospect of a vaccine. So you have a kind of, as it were, two boxing gloves to pummel the disease in the weeks and months that follow. But I've got to stress that we're not out of the woods yet. It does still require everybody to follow the guidance, do the right thing to suppress the disease in the way that we all understand. I've got no inhibitions about getting a vaccine, but and I totally encourage everybody who is eligible for a vaccine, the people who are most vulnerable. Of course, everybody should get a vaccine. Certainly, I would say to everybody, anti-vax is total nonsense. You should definitely get.
Now, one country I'm going to look at in terms of healthcare is the US of A. And when we think about America, obviously they're the biggest superpower in world economics. And we'd probably expect that their healthcare would be to a high standard. But actually there's real problems with American healthcare. And a lot of it is to do with, I suppose, free market aspects of their healthcare. Now, America, they have a lot of it is based on medical insurance, health insurance, and as we can see here, healthcare is still too expensive for most, or that's the consensus, that's what a lot of research suggests. So a majority of US adults actually delay getting any type of treatment or put it off completely because of the cost which is afforded to it. And that was research that was carried out from a financial website, Earnin. Now, according to the research, which combined Earnin user data with data from Harris Poll survey of more than 2,000 adults, 54% of Americans say they've delayed care for themselves in the past year because of the cost. Another 23% delayed care for more than a year for the same reason. Now, the three types of care that are delayed most are dental work, eye care, and annual exams. But when we think about annual exams, you could probably argue that they are definitely underconsumed or undervalued because they think, oh, I'll be okay. I'm not showing any symptoms, I'm not showing any signs of ill health. But actually, those annual exams can really help to prevent, and therefore, we cannot really afford for them to be undervalued. So of those who have delayed care in the past 12 months, 55% put off dental and orthodontic work, 43 put off delayed eye care, and 30% put off annual exams. And in fact, research also shows that one of the biggest reasons why sometimes there can be an influx in buying healthcare or accessing some of these is when they get tax returns, which really shows that the cost is a massive factor, because if they're only going to buy it because all of a sudden they get a tax return and they get money which they didn't expect, and they can then put it towards healthcare. That I think that shows a lot of worrying concern of the American healthcare system. Now, and again, when we're looking at some of the data, this was some of the research that was carried out, but we can see in terms of the different colours, I've put off medical care for more than a year because I could not afford it, and I've delayed medical care in the past 12 months. The figures are quite high. Now, when we're again looking at inequality, because America, unfortunately, even though it's a superpower, it's got high levels of inequality, and we can see more unequal nations, such as the US, have higher infant mortality, and that again is to do with healthcare, and that's the consequences of not being able to access that healthcare. Another factor is that high-income Americans are living much longer than the poorer Americans. So we can see in terms of the bottom 5% how low it is and the top 5%. And again, that clearly has to do with healthcare, but also the ability to live a healthy lifestyle. And if they cannot afford to access the healthcare that's required, then obviously that is going to have an impact on their lifestyle and their ability to live longer. We've also got a factor in terms of the very rich living 10 to 15 years longer. So that just kind of tells you a little bit more about this data. Let's do is I'm just going to show you one more video, and it's based on a comparison, and there's often comparisons between America and Canada, and this is based on in terms of the tax system of America, because there's sometimes accusations that the American tax system, it doesn't contribute enough towards these type of merit goods. And even though we'll see from the video that they spend a lot on public goods such as national defence, again, that might be a government failure, because actually that money could be better suited towards merit goods rather than the need to fund so much for national defence. So I'm just going to show you that video now.